All right, joining us for a chat is Claudia Chender, leader of the NDP here in Nova Scotia. Claudia Chender, thanks for doing this today.
Thanks for having me, Todd.
All right, so healthcare. This is something that it impacts us all in a pretty big time way, and it just seems to be that the negative stories just seem to keep coming here, and sobering stories. Another ER issue, another death at an ER, and a doctor in Middleton not at the scene. It's troubling to say the least here, right?
Yeah, it really is. And, certainly I want to start by saying that this is a tragic circumstance, and you have a community that is upset and a family that's grieving. And so my heart goes out to all of those folks for sure. But I think, as you say, what we're seeing are more and more of these challenges on the front lines. And I think when Nova Scotians decided to vote for fixing healthcare, this is not what they had in mind. The announcements we see are about kind of stopgap measures and technological changes, when I think, the experts are pretty clear that we need a real systemic overhaul of our frontline care, from, preventative medicine up through family medicine and into our emergency rooms. And we're just not seeing that. And sadly, we just hear these tragic stories from Nova Scotians who are suffering as a result.
Yeah, and the government, I guess, in fairness, they're working at it hard. Their solutions are not easy, right? Let's be fair. It's not an easy thing to fix.
Oh, it's not. It's not at all. It's a huge project, but I think the frustration that people I speak to are feeling, and that certainly I'm feeling, is that we don't understand what the vision is. So, I think we've been very clear that we think that we need to find a way for people in this province to have health care they can count on, so that they're attached to a family health home, that they can access their emergency room, that we grow the kind of collaborative care model that our government brought in. But we don't really know what this government's vision for a fixed healthcare system looks like. And so in the meantime, we know they're spending lots of money. Mm-hmm. We know they're focused on healthcare, but most people that you talk to on the street in this province don't see a change. And, 2 years in, I think that just gets really frustrating for people. And so, we want to understand what that change is going to look like and when we're going to see it, because while we do have, certainly some good things, we have the mobile health clinics, and, we have this doctor incentive that maybe will help something. We're not seeing those big changes that people feel like are going to make that difference in their own lives, And in the meantime, the numbers are not good. We have 150,000 Nova Scotians who are not attached to primary care, and we have communities like Middleton all across our province where people feel like they do not have equal access to medical care, that, it's based on where they live. They are unable potentially to get the care they need. And that's something that makes people upset and nervous. And, I think the government has to answer for how they're going to alleviate those fears and make those changes.
Yeah, and I get it. In the community, everybody says, why do we not have a doctor here? This should be fully staffed. Why are emergency rooms closed? I don't think Tim Houston or any politician ever wants, or any health authority ever wants to close an emergency room. It's not as though it's only being done because of the human resources. It's not about spending, I guess, is what I'm getting at here. They're not trying to save money by closing ERs. They don't have the bodies here. So how do you combat that?
Yes. I mean, you and I have talked about, Todd, and I think everyone now knows the huge staffing issues, from doctors to nurses and to paramedics and right on through in our medical system. And absolutely, I think, nobody wants to see a situation like that. But on the other hand, we have hundreds of millions of dollars going out the door. And so money isn't insignificant in this question in terms of attracting healthcare professionals. And in the end, it's about choices. And so, I was in Middleton months ago in the middle of a snowstorm when the entire community kind of galvanized and came out to protest and said, we don't feel safe. We need this government to tell us how we're going to be safe when this emergency room is not open, because, of course, Middleton's not unique, but their geography is such that Kentville and Yarmouth are pretty far away, and those are the only places that they can find an open emergency room if theirs is closed. And in a matter of life and death, that can be too far. And so it isn't like this issue wasn't known. And so again, it's about priorities and it's about choices. And no one's saying it's easy, certainly not me. But it would be helpful if we understood how we're going to get there, how we're going to get to a place where people don't feel scared about needing to access healthcare. And unfortunately, right now, most of the people that I talk to feel like access to healthcare is getting harder and harder. They're worried about getting very ill, or if something like what happened at Middleton happened to them, depending on where they live. And, that's a way we don't want any Nova Scotians to have to feel.
All right. What about collaboration? I know it's difficult for collaboration when it comes to politics, and partisanship is there, but it would be nice if we could have our MLAs working in the same, rowing in the same direction, I guess is what I'm getting at, and we could set aside some of this bickering that we have. What are your thoughts on potentially trying to figure out some type of collaboration politically here to solve this thing?
I couldn't agree more, Todd. And, I certainly didn't get into this job to fight with people. I decided to go into politics to make people's lives better. And, I think what I have seen, I think part of it is just the way that our political system has evolved. But it's certainly gotten worse in the last couple of years, is that every opportunity for collaboration has been essentially cut off by this government. So we don't go to the legislature, barely at all. We may be in the legislature for 5 or 6 weeks in a calendar year. That does a disservice to the public, because that is our opportunity. It looks like fighting a lot of the time, I know. But, when we have a system for when a bill moves through debate, and that debate is really important, and that debate is a kind of collaboration. There are opportunities for the public to have a say. We could have a much more robust committee system where MLAs could understand the issues better. But as it stands, we get no communication from the government in the opposition. We don't know what's coming. We don't know the logic behind it. We aren't given the tools in many cases that we need. And so then what we are left with is to demand them and to, have conversations like the ones that we're having today. But I think if you ask most of my colleagues, we would much prefer to be solving problems together. And there is a precedent for that. So there was a period during COVID when we had this unprecedented challenge to our province where we did have an all-party briefing table. And we were alerted to policy changes before the public was. And we were able to both, let government know on behalf of our constituents what some issues might be or how that might impact, but also to better understand them and contribute. I would love to see a system like that. But, I think as we've seen from the Premier's statements particularly over the last couple of weeks, he's fighting with everybody right now. So he's fighting with the federal government. He's fighting with municipalities. This issue in Middleton came to light because the mayor of Middleton is pleading for a change. Similarly, we have a mayor in Amherst who is saying the same about the isthmus, and we're not seeing collaboration. And it has to start at the top. There has to be that leadership, because the way that our system works, that the Premier's office has an enormous amount of power. And unless they want to collaborate and they want to invite other parties in, there isn't an open door. So we do, this is our opportunity. The way that we can have an influence is to be involved in public engagement and in public debate, and to be connected to our own constituencies. And for myself, I spend a chunk of every single week traveling around the province so that I can understand the issues on the ground. But, I'd like nothing more than to be able to contribute to the solutions in a more collaborative way. But that doesn't seem to be the mode at the moment.
Okay, Claudia, appreciate your time. Thank you so much.
Thanks so much, Todd.
All right, take care. Claudia Chender, leader of the NDP.